Any further thoughts that you guys want to summarize or add with regards to the data that we saw here at ASH, or any key point in CLL that you want to comment on before we close? Or we?
Well, I can try.
Yes,
yeah,
we'll
sure.
go down the
so,
line.
I think it's exciting to see this wave moving away from chemotherapy-based treatment to the new agents. It's beneficial to our patients, but now we are facing a lot of new issues that we haven't addressed. Basically, we don't know in most cases how to best use them. We still need to define that. Right now, we talked about what is standard treatment for many patients, which are the BTK inhibitors. First, second generation venetoclax as a good alternative or as a good salvage option. But it's a transition period. In the US, we are in a special situation because we have all these agents available. Many other parts of the world not yet. So it's interesting times, and I think it's time for additional clinical trials to address these new questions.
I will join the same conclusions. I think we are quite exciting times, considering that start to really have multiple alternative therapies, being BTK inhibitors, being BCL2 inhibitors, new drugs coming up that we saw today, alternative reversible BTK inhibitors. I think it's a great time for our patients to really make sure that they can really have a long life, expectancies, and definitely start to really thinking about in the future also how we can address these profound immunodeficiencies that we see of those patients, because our patients are going to live longer, so we're going to be exposed to infections overall and also the secondary cancer. So I think this era, I think, is going to bring the next kind of problems of how we're going to treat those long-term patients and how we're going to be able to restore the immune system of these patients.
Right.
So I think, as everyone has already mentioned, that this is an incredible era to be taking care of CLL patients, that the number of therapies we have available to us is constantly increasing. We certainly need to understand how best to use these therapies. And a word of caution, if I may, that, FDA approvals are certainly not treatment recommendations. And I think it's important to understand where we're missing data. And what we talked about a lot at this meeting were sort of what we need to do to fill those gaps, like duration of therapy, combination therapy, and so forth. So I think in the years to come, we'll sort of tease out these important questions.
I agree. I think all of these developments have been really exciting for our patients. And this is the time when we can sit down with the patient and discuss all of these alternatives and look at their likes and dislikes and preferences and comorbids. And then make a decision. But I agree. I think FDA indication approval does not necessarily mean they're ready for prime time use. So I think for most of us at this point, treatment upfront with a single agent BTK inhibitor would still be the correct answer for the vast majority of our patients, and then possibly venetoclax in some way, shape, or form. So I think these are exciting times. We're very excited, and hopefully we can build on all the work that's been done so far and improve the outcomes for our patients.
Wow, who would have thought that we all agreed in the end by saying that? So,
Thanks to you, Nicole.
Thank God they're tape recording this. I think that just to summarize for the panel, for all of you, clearly it's wonderful to have all these agents. I echo my colleagues' sentiments. It is, just because we have all these agents doesn't mean we should use all these agents, and we really need more mature data. We don't know how to use MRD yet. So these are things that probably shouldn't be done outside of the context of a clinical trials. We need to have these clinical trials so we can further the development and how to sequence these drugs best, whether it be in combination or sequential therapy, and which patients might benefit from which therapy. So until that happens, we all agreed for once. So I want to thank you on behalf of our panel. We hope you found this peer exchange discussion to be useful and informative. And thank you, gentlemen. You all behaved.